In my time as a musician, and I continue to play bassoon as well as piano and guitar, I know firsthand how even minor pains and stiffnesses can cause massive impacts in our ability to play instruments, use a racket, hold a golf club, or do the activities they like to do in their daily living. I'm Dr. Brandon Schulman. I am an orthopedic surgeon with a special interest in hand and upper extremity surgery as well as traumatic injuries throughout the body. Arthritis is an extremely common problem in the hand, and it's something that for many people, it's a problem that begins to develop even in their late 30s and early 40s, but usually patients don't become symptomatic until a little bit later in life. And hand arthritis can present in a variety of ways. Obviously, there are many bones in the hand and wrist, and therefore there are many opportunities for arthritis to set in. One of the most common areas of arthritis is the base of the thumb, what we refer to as basal joint arthritis. And the base of the thumb is a privileged joint because it allows us to oppose our thumb and move our thumb in multiple planes, but it pays a price in that motion by seeing extra wear. For the gross majority of my patients, this is something that we can treat without surgery. This is something that we can manage with bracing, physical therapy. One of the areas I have a personal interest in is the treatment of scaphoid fractures. The scaphoid is a small bone in the wrist below the thumb, and it's frequently injured when patients fall on an outstretched hand. I have subspecialty training in microsurgery, and one area that I think microsurgery can really help is the treatment of advanced and complex scaphoid fractures. And one of the treatments we can do is called a vascularized bone graft. We can take bone out of the inside of the knee, in an area of the knee that doesn't bear weight, that you don't need for your knee function, and that bone is attached to an artery. And we can remove this piece of bone with its arterial attachment to it, implant that bone in the wrist within the scaphoid to allow the scaphoid to heal and reconnect the blood vessels within the wrist. And what this allows us to do is not only give the scaphoid, which may be missing some bone, that bone back so it can heal, but that bone itself is vascularized and promotes healing. And this has really changed the way we treat complex scaphoid fractures and is something that I specialize in here at Connecticut Coast Orthopedics.